Yeah, I'm here today with Kathy Anderson, who works at Critical Care with the youngest members of our population. So Kathy, could you tell me please your title and your credentials?
Yes, I'm an RN, Master's Prepared, and I've worked in and out of NICU, Newborn Intensive Care, for 25 years of my career at a couple of different hospitals, and one of them was downtown here in Boise.
Excellent. So you worked in NICU and some in the PICU, right?
Yes, I did
And
float to PICU, Pediatric Intensive Care.
so NICU is neonatal intensive care.
Neonatal, and neonatal is under 30 days, or of course we keep them if they're born to us and need to stay a longer period of time. They go beyond the 30 days, but we won't admit a child to NICU generally who's older than 30 days.
Okay, and then they would go to
The PICU.
Yes. So what's the age range in the pediatric intensive care?
So again, anyone who is over 30 days of age and as old as before their 18th birthday, because those nurses are better prepared to meet the intensive care needs of basically children, and even big teenagers are still children in many ways with their medical needs.
I think as a parent, I would want my child there where the most experienced nurses are with the pediatrics.
Well, it's a good place to be if your child comes across an illness or extension of the NICU period and is in need of care. Adult ICU is really not appropriate for pediatric age children, even though in some smaller communities that's all they have, right.
Right. So we're going to focus right now just on the NICU because that's where you're most experienced in, and I think you could give us good information.
Yes, I'm a level 3.
A level 3, what does that
Level
mean?
3 NICU nurse is the highest level of certification. We have the company that certifies maternal child nursing provides a general low risk neonatal certification and a level 3 NICU certification, which covers absolutely every type of care that a newborn in risk might need.
So at your level, you'd be a great mentor for the new batch.
I would, if I were still working in that.
Okay, so the patient population of that unit, you said under 30 days. Is there any specific disease processes they have to be in that unit?
There are so very many interesting and sometimes sad cases that we get. All of the different malformations that come with giving birth. You never know really if you're going to get a perfect specimen of an infant, even though parents have a Gerber baby in mind. It doesn't always work out that way. So NICU is really for any infant in distress or at risk. It could be a micro preemie from 23 weeks to say 26 weeks to full term, or they can be at risk due to trauma of birth or auto accidents. They could have malformations or genetic issues or sepsis or maternal issues such as diabetes, placental separation, toxemia. Just so many different things that come up that are so unexpected that always keep us on our toes when that buzzer goes off in labor and delivery.
Oh, imagine. Now, you're a level 3, so you have a lot of experience, a lot of education. You said you're master's prepared. What would be the nursing education or preparation and training needed to practice on that complex unit? Our students are finishing their bachelor's.
Right.
What do they need to do to be prepared to work there?
Well, I think that your students who are going from an ADN program to a bachelor's prepared level already are aware that over the country there's becoming a big push to have your at minimum entry level of a bachelor's degree. And a lot of the specialty areas will want either that you have your bachelor's degree or that you are enrolled in a bachelor's degree program before they'll train you. So therefore, having a bachelor's degree is ideal. At least having, as I said, be enrolled in a bachelor's program before you go hunting for this upper level of training and education.
Do they have to take separate classes, or are they trained on the job by mentors, and what else do they need to work in such an intensive unit?
That's a good question. You might realize that it would be impossible to set up much of a training course in caring for newborn infants at high risk. So they're actually trained on the job, and we start them off with the children that we call the feed and grows. There are those in rooms of less high risk that are still growing, still developing, but are through with their high risk factor. And so we start the newer nurses becoming more comfortable with the care of those feed and grow infants, and then they're available to watch deliveries and to watch initial assessments and admissions of higher risk infants until we gradually graduate them up to higher levels of care over a long period of time.
Now, you mentioned the certification.
Mm-hmm.
Is that available then for nurses that are they have their baccalaureate degree, they've gone through some training? I mean, how far along do they have to be to get certified?
Well, once you have achieved a level of confidence, and I believe the minimum is 2 years of on-the-job experience, you can either sit for the let's see what it would be, the low-risk infants certification, or the level 3 NICU nurse certification. There's a company called NCC, National Certification Corporation, and that's they specialize in the obstetrical and children's area of certification. They also give you certifications in, say, infant transport and intubation of an infant and NRP sort of things.
So when the nurse is on the unit and they're getting their experience and they've got some time in, does the hospital help them work towards certifications? Is that beneficial?
Well, most of the study is done on your own. However, most of the larger facilities at least do offer reimbursement once you've passed the program and become certified. It is in their best interest to have those sorts of levels of nursing, and they will reimburse for the expenses of getting certified.
I would think it'd make a higher level nurse.
It would. It
More
definitely
education,
does.
self-directed
It
learning.
certainly doesn't, no one questions your ability once you get certified.
Excellent. And so these tiny patients, little under 30-day patients, where do they transfer to when they're well enough to leave the NICU, but yet maybe not well enough to go home?
Right. Well, like I told you before, there are different areas at different levels of risk within the NICU. Once we have them, we don't transfer them. When they go home.
Okay.
And it's sometimes a very daunting process because we've got to ensure that they can be properly cared for at home. So the training goes on for the parents while the baby is still in NICU, and we're made sure that they can continue to care for their needs once they go home.
So the parents of the babies,
Right.
do the nurses give them this training, or
The nurses are all about the family. When you get a NICU baby into the unit, you get a family, and you cannot separate one from the other, nor would you want to. Initially, the parents are not allowed to hardly touch the infants, especially the very sick ones. We have a hard time letting them even get near them other than to gaze at them. And so it's part of the nurse's job in NICU to ensure that reunification of the family as the infant gets sturdier and more able. That initial bonding, which is sometimes just really a broken project, needs to be rebuilt, and the confidence of the parents needs to be built to the level where they feel good about taking this infant home.
I can imagine if they're
Right.
if parents are in the unit seeing all the technology that you're utilizing there. Could you tell us a little bit about the technology involved in the NICU?
Yeah, absolutely. I could go on forever about the technology because, at the beginning of my career, we would be able to tell a parent of a 28 or 29-week baby that maybe we could have a 50% chance of saving them, and maybe they could see and hear and not have cerebral palsy at the end of that length of stay. And today, because of technology, we are able to actually save 23-week infants, and many times without any sequelae, without any hearing or sight problems or intellect issues or cerebral palsy, which in the past, due to the incredible thinness and delicacy of their systems, would be so easily damaged even with the best care. The better technology has allowed for us to support their respiratory system in particular without the damage that used to come from the more vigorous machines.
Great. Is there anything else you want to share with us about the NICU?
Well, let's see. When you get a NICU baby, oftentimes, especially with the micropreemies, you will have that baby and you will probably special that baby and their family for weeks or even months. And so it's an unusual situation that you don't find, I don't think, anywhere else in acute care hospitals. You develop a close relationship, and you do have to be able to temper that with your professionalism, to be supportive and not actually join the family. But even here, 40 years later down my career, I still get Christmas cards from the triplets born Fourth of July,
Oh my.
40 years ago, and how they've grown and are married and have children. So it's the sort of thing where the parents never forget you, and you become vicariously a part of their family at a very crucial time. So the rewards are great. People ask me, is it sad to do that kind of nursing? And I say that in the units that I've worked for, with the technology that has been afforded us and the training, that if the infant does not make it with our care, then that infant was meant to go back to heaven. Because it's a very joyous thing to work with parents and the infant all of this time and send them home to their loving family, intact and whole and doing well and looking so much different than when we first got them.
Well, thank you. It sounds like a great place to work if you like little babies and families and you have compassion.
Very rewarding, very tense, very intense, but very, very rewarding.
Well, thank you very much for your time.
You're welcome.